the next session. How was this session for everyone? I'm pretty sure everyone is waiting for the next session as well with Dr. Vijay Mohan Kohli. Let me bring Dr. Vijay on the stage, please. Give me a minute. All right. Dr. Kohli, a very good afternoon to
Good
you.
afternoon. Thank
How are
you.
you doing, sir?
I'm good. And you?
Very well. Thank you so much. Allow me to introduce you to the
Sure.
attendees. All right. So, definitely, we are now into another innovative frontier with Dr. Vijay Mohan Kohli, who is a distinguished cardiac surgeon and a functional medicine expert, also with decades of experience. Today, he will be taking us through the transformative potential of light therapies in cancer healing. So it's going to be a cutting edge approach and at the same time, ancient wisdom coming together to create a wonderful advancement in cancer care. So, Dr. Kohli, a very warm welcome to you once again and a very, very enlightening topic. I really look forward to everyone enjoying the topic as well. I'm just moving off the stage. The stage is all yours. I can see the screen.
Okay. Okay. Well, first, thanks a lot for giving me this opportunity. I'm especially thankful to Dr. Ashwini for having invited me for this. Now, the very first thing I would like to tell you is that, as per my understanding, light is life. This is not just a belief system, but something that is confirmed by science. Specifically, light is present in between the cells. And this is how the cells actually communicate. And when this communication gets lost, we develop diseases. And if you look at it from the spiritual perspective, light is a vibration, light and sound together is the creative principle for the entire creation. Now, there's a lot can be said about that, but we'll skip that for the moment. Now, a healthy body captures light, stores it, it reabsorbs it, transforms it, and ideal health depends on our ability to use light. And there are photoreceptors in the eye, skin, gut, lung. They capture light information. And these options then activate our internal pharmacy to make our neurotransmitters and everything else. And also, light tunes regular water into charge separated E zone. Now, we are not talking about E zone right now, but it is important because there's a basis, I can say it is the basis of good health. We talk of dehydration, so this is how this hydration is important. And also, respiratory proteins on the inner mitochondrial membrane take light of one frequency and convert it into another. Now, light is the driving force. Now, all our signaling molecules, metabolism, cognitive function, sleep, anti-aging effort, they are all subordinate to light, water, magnetism, and electromagnetic frequencies, both good and bad. Biochemicals are virtual passengers along for the ride. So this is how important light is. It is the driving force for whatever else happens in the body. If you look at it from the perspective of science or physics, light is a particle of light. It is a particle which is a photon, as they call it, which is just a particle with no mass at all. It is therefore purely energetic in nature. And Albert Einstein also said, everything is energy. So if light is energy, it is the most important fuel for the body and all the cells present in it. This explains a lot. Now, if you look at it, the light spectrum, only 39% is visible light. The remaining is invisible. Anything beyond the red area is infrared light. Anything beyond violet is ultraviolet light. And light, as has been mentioned earlier in the discussion today, affects our circadian rhythm as well as our mitochondria. Now, if you look at the spectrum, blue light sets a circadian rhythm in the brain. UV light is important for vitamin D synthesis. Far infrared acts to heat up our cells, which stimulate changes in cell function and circulation. Red light is needed for increased cellular energy through mitochondria. Near infrared has similar pathways. But unfortunately, we are deficient in all the 5 types of these frequencies. Now, circadian rhythm has been, of course, mentioned in the earlier talks also today, but let me just expand a little bit on that. Circadian rhythm is dependent on light, and circadian rhythm regulates many cancer hallmarks, including cell type, control, apoptosis, metabolic regulation, and DNA damage response. Unusual circadian rhythm has been linked to so many types of cancers, of which breast, colon, prostate are a few of them. Now, what happens when the light enters the eye? When the light comes into the eyes or retina, it stimulates the intrinsically photosensitive ganglion cells in the retina, which then transfers it to the superior chiasmatic nucleus. Now, this is what happens, and because of this, a lot of other things take place, including the production of not first production, first melatonin shuts down if you're exposed to the early morning light. Now, when you're exposed to the early morning light, the night time, that is the melatonin produced from the pineal gland shuts down and cortisol kicks in. At the same time, daytime melatonin starts forming, which is important for the day, as well as your evening melatonin. So exposure to the sun has been talked about today also, but I'll very briefly mention. We need to be exposed to the early morning light for the near infrared, exposure to the ultraviolet between 10 and 12 noon. And the evening time is also important because the colors which you see, orange and red, red has been mentioned about by Dr. Lenny also. This is important for our melatonin production. Now, what does the SCN do? It has 3 main functions. It helps control every metabolic and growth program in the body, including speed of your metabolism through leptin receptors, sleep and recycling of mitochondria through melatonin, and fertility through testosterone and estrogen. A point I'd like to make out here is that the master clock, that is the circadian signaling, has to run several milliseconds above those of the other organs. Otherwise, there can be a discrepancy in relay. Now, I will not talk much about melatonin because Dr. Lenny has covered it. Unfortunately, I missed the earlier part of his presentation because of connectivity issues. But I would just like to highlight one point here, which he must have mentioned. Less than 5% melatonin is produced from the pineal gland, and more than 95% from the mitochondria in response to sunlight. This is subcellular melatonin, which Dr. Lenny was talking about. Now, this is something very interesting. Now, this Kaya Kalpa, you might have heard of this. Kaya Kalpa was something which our ancient rishis, at least some of them, followed. And they actually would be able to transform themselves completely. They would get a hut made, dug into the ground, and covered with thatch and leaves and mud, and would stay inside there for months together. They would often enter at a very elderly age, around 80 plus. And then when they came out of that, they would look almost 30 to 40 years younger. And how did this happen? What would happen would be that the sunlight on acting on the mud and the leaves and the certain silicates present in that would help in the formation of melatonin. This melatonin acts on their bodies, and the nighttime melatonin continues because the whole thing is dark. So they are bathed in continuous melatonin day and night for months together. What happens then is that the entire body dissolves, all the tissues dissolve, then the stem cells kick in and they regenerate the entire body. So that is how effective melatonin can be. This is just as an example to show how great a molecule melatonin is. Now, another point I would like to make is biophotons and cancer. Now, biophotons are light emissions by living tissue. Every living tissue is emitting these biophotons. A cancer cell also emits more biophoton than a healthy cell, and its degree of coherence is reduced. In a healthy cell, biophotons are mostly emitted and recaptured internally, and only relatively few escape to the outside world. Cancer leads to a loss of organization of the organism, which manifests as an increased leakage of biophotons. Now, why I mentioned this slide, shown this slide is that this can be worked upon more scientifically to come out with some better investigative techniques for this. But also it has been shown that those who meditate and advanced meditators, they don't lose that thing. They don't lose the biophotons. Now, coming to the therapies, the very first one which came into being was the photodynamic therapy. Now, in the photodynamic therapy, the cancer patient is administered with what is known as a photosensitizing agent or substance. And this concentrates in the cancer cells. And then this is activated after some time, it is activated by light. And when that happens, reactive oxygen species are formed, and these then destroy the cancer cells, but do not have any effect on the normal cells. So this is the principle of the photodynamic therapy. Now, what are the uses? You see, it has been used since ancient times, both in Egypt and in India. And earlier they were using photosensitizing agents, namely from plants like sorrel, many other plants, seeds of sorrella, cortiflora, fog, parsley, celery, citrus fruits, etc. And it offers the least invasive and most rapid treatment, particularly for non-metastatic cancers of the skin, the blood, and the linings of the internal organs such as the esophagus, lungs, stomach, bladder, prostate, wherever light can reach. This is the important point. This was then modified into the PDT plus therapy or technique. This technique uses advanced multi-wavelength laser light technology that delivers specific wavelengths in the ultraviolet, visible, and infrared regions of the spectrum. And it uses fiber optic technology to deliver laser light directly through catheters. It can also be given intravenously into the tumor. Each of the laser light wavelengths is capable of activating photosensitizers specific to that wavelength, thereby significantly increasing the range of PDT methodology. So it can be modified by using curcumin, hypericin, indocyanine, green, etc. Now, then came along what is known as sonophotodynamic therapy. Incidentally, all of these are in vogue and are being used. I borrowed this from Dr. Jimenez's experience. So sonophotodynamic therapy involves using sound and light in combination with a sensitizing substance called SP activate. The patient first takes SP activate, it can be given sublingually or intravenous. It is picked up by the cancer cells in a ratio of 70 to 1. That is, 70 cancer cells pick it up, just one normal cell picks it up. One waits for 24 to 36 hours, during which the cancer continues to absorb the substance, while any other cells, if they have absorbed it, will relinquish it. And thus the awakened SP activate produces reactive oxygen species, which are negatively charged oxygen molecules, as you know. SPDT decreases angiogenesis, thereby stopping the creation of new vessels. SPDT also activates the immune system and recruits immune cells to migrate to the site of tumor. In addition to destroying the cancer cells, SPDT has been effective in eliminating tumor-associated pathogens as well. Being non-toxic, it is very useful as a long-term treatment for tumors without the side effects of other conventional approaches. Now, this is Dr. Jimenez's experience. In his experience, 48 to 54%, he found decrease in vascular flow to the tumors and the lymph flow after just 3 weeks of therapy. And he compared this with the baseline ultrasound, which uses high resolution color ultrasound. Now, it has been shown that SPDT markedly inhibits tumor growth and cancer cell migration in lab mice with breast cancer metastasis to the lungs. These researchers also found that sonodynamic therapy and photodynamic therapy were combined. When combined, they were much more effective than either therapy used alone. So SPDT is emerging as a very important treatment for a variety of cancers. In Dr. Jimenez's experience, he found that he combines SPDT with a number of other techniques, which are all basically functional medicine techniques, like combining it with immunomodulation, full spectrum nutrition. According to him, nutrition plays an extremely important role. Detoxification, again, we come into the fact of detoxification, which we are using for practically all chronic diseases. Oxygenation, restoration of the microbiome, along with emotional and spiritual healing. He lays a lot of stress on emotional and spiritual healing. So when all of these things have been combined, He has found very good results in tumors located in the pancreas, prostate, breast, kidneys, and liver. It is also found to be effective in treatments of melanoma, head and neck cancers, lymphomas, and sarcomas. IV photodynamic therapy can be used to target leukemias and cancers. He also found cancer cells both locally and systemically can be targeted. SPDT reduces tumor burden, reduces vascularity, activates or modulates the immune system, destroys pathogens, improves the patient's quality of life. Now, what are the uses and limitations of SPDT? It is virtually useful for all types of cancers except brain tumors, as it does not penetrate through bones such as the skull. It is not effective for blood cancer like leukemia, as SP activated sensitizer only absorbs into solid tumors. Why are both light and sound needed? It is very difficult to get light to penetrate past the superficial layers of the skin. So as you know, light cannot penetrate too deep. Sound, on the other hand, can travel through water very successfully. As we know, our bodies are made of 75 to 80% of water. So sound waves use that leverage to travel to tumor sites located deep inside the body. You can use a combination of these also, combining IV photodynamic therapy with sonodynamic therapy. It is possible to achieve stoppage of tumor growth, reduce its size, as well as eliminate any circulating tumor cells. It is very important to address the genesis of the cancer as well. Not only this, but look into the factor which caused it. So combine all that together. Now coming to near infrared sauna, of which we keep talking a lot about, we're using it also so frequently. Now specific light wavelengths individually have profound therapeutic benefits. This is known as photomodulation. Near-infrared light represents physiologically relevant wavelengths of light that resonate with the body's natural energy. The body recognizes it as familiar and non-threatening. So what does it do? It reduces the body's pathogenic load by killing infection-causing bacteria and viruses, helps to eliminate cancer-causing chemicals such as heavy metals via the perspiration route, reduces the body's radioactive load in patients who may carry as a result of prior radiotherapy treatment, may relieve pain and improve blood flow. It is very relaxing also. Stimulates the immune system and reduces inflammation. Helps to reduce plaques from arteries as well. Can also be used as a type of photodynamic therapy along with SP activate. There's something known as photoimmunotherapy as well. This is based on the fact that monoclonal antibody therapy has been found effective in destroying cancer cells. Now, Dr. Kobayashi and colleagues, they modified this. They coupled these monoclonal antibodies with photosensitive dye molecules, and they settled on a fluorescent dye called IR700, which is activated by near infrared light. They chemically linked this to three different monoclonal antibodies. One antibody targets HR2, found in cancer breast patients, another to EGFR, receptor molecule prevalent on some lung, pancreatic, and colon cancer cells. The third homes in on PSMA, a molecule overexpressed by prostate cancer cells. The researchers found that the MBIR700 complex is effectively attached to cultured cancer cells. When exposed to near-infrared light, the targeted cancer cells rapidly died. In contrast, cells that weren't bound by the complexes were unharmed. So near-infrared lamps are freely available and not very expensive either. They promote deep tissue healing, and they can be combined with photodynamic therapy and even with SP activate for destruction of cancer cells. The red light panel is now available in India. I think it is very effective also, quite freely available, and I think it should be tried. There's something known as a low-level laser therapy photomodulation, where PDT plus watch has also been devised. Now, the light frequencies are transported into the wrist veins and carried throughout the body, energize, oxygenate, and heal the cells. It is like a rainbow with a broad spectrum of colors. Red light binds with hemoglobin and improves oxygen uptake by up to 20%, thereby decreasing hypoxia in tissues and stimulates mitochondrial energy production. Blue light, helpful for energy production, enhances nitric oxide production, decreases inflammation, and activates telomerase. Yellow light promotes serotonin and vitamin D metabolism. Green light binds oxygen to hemoglobin and improves mitochondrial function. It is recommended to wear it for an hour or two daily. Now, coming to something which is very subtle, but I attach a lot of importance to this, that is meditation. Meditation, a tremendous amount of light pours in, which is a great driver for neurotransmitter and cellular function, detoxifies the cell at the deepest level, and is conducive to healing. It improves heart rate variability. Of course, a lot depends on how deep you can go in meditation. It has been found by Dr. David Hawkins in his wonderful book, which is written Power of Force. The highest vibrational frequency has been found with enlightenment, which also means being full of light. Enlightenment, the literal meaning is being full of light, followed by peace, joy, love in that order. Now, let us not forget that the 5 elements of nature are antagonistic to each other: water and fire, air and fire, for example. But it is the light of the soul which keeps them bound together in our astral bodies and helps the body utilize their full potential. This is another important aspect of meditation. Connecting to oneself goes a long way in correcting your issues. Another important point I'd like to mention is that the level of spiritual evolution of the healer has a lot to do with improvement in the patient's recovery healing. Unfortunately, we in functional medicine are not focusing enough on these aspects. If we ourselves are not conscious, if we are not, let's put it very mildly, not positive, then what type of vibration are we transmitting to the patient? The patient comes to us in faith and hope. So therefore, our own consciousness has a lot to do with the patient's healing. To conclude, light has many very important functions, hence it is essential for life. A number of light therapies, including photodynamic, sonophotodynamic therapies, near-infrared or various combinations, have been found to be quite effective for cancer healing. Effectivity increases when combined with detoxification, management of gut issues, proper nutrition, correction of deficiencies, and of course, meditation helps a lot. Thank you very much for your patience.
Dr. Kohli, pretty much a very, very insightful presentation over there. I can see that the participants have really loved it, and with all the insights that you had put in regarding meditation, light, and all the ancient things as well that had been used in the past. Totally agree with what all you have said. I'm just going to remove the share from the screen.
Please, thank
And
you. Thank you.
I will also, one of the participants is also saying we are light. So, and a lot of compliments from the panelists as well. So, Dr. Ashwini Garg is also saying absolutely brilliant. We are all part of light. Um, and of course, Mahesh Jairaman also fully agrees with what all you have said. I could not see any questions on the chat box. So I believe everyone, okay, we are enlightened. Thank you very much. Perfectly, I think, concluded the session. Thank you very much, Dr. Kohli. I really, really appreciate whatever you have shared. Undoubtedly, sometimes we just miss those things. Thank you for reinforcing the things once again into all of us. And I'm pretty sure everyone would have appreciated all of that and will be inculcating it in their lives as well. So thank you for
Thank
making
you.
a wonderful difference for so many years in the life. Thank you for your
Thank you very
expertise, sir.
much. Thank you.
Thank you.